Most seniors over 60 have been told the same thing their whole lives. Drink more water, 8 glasses a day. And if you want healthy kidneys, drink water before bed. Simple, clean, well-intentioned advice. And for the most part, not wrong. But here's what most seniors are never told. Plain water before bed is not the most effective thing you can give your kidneys overnight. Not by a long way. And the drink that actually works? Most people have every ingredient sitting in their kitchen right now. I've seen this in my own clinic. Seniors who made this one switch reported noticeably less morning puffiness within the first week. At the 90-day follow-up, their kidney function markers had measurably improved. No new medication, no procedure, just the right drink at the right time. But this is the one I see most often. Patients waking 2, sometimes 3 times every night to use the bathroom, for months. Exhausted, frustrated, assuming it was simply age. The culprit in case after case was the exact habit they believed was protecting their kidneys. Once they switched, the disruption stopped within days. Their kidneys got the support they needed, and they got their sleep back. Here's what most seniors don't realize about what their kidneys actually need after dark. My name is Dr. Sophie Martin. I'm a urologist with over 20 years in clinical practice, and today I'm going to show you exactly what to drink before bed and why it works at a biological level to support your kidneys while you sleep. The drink itself, the 3 ingredients that make it work, the 3 things most seniors drink before bed that are doing the opposite of what they think, and a complete before-bed kidney protocol you can start tonight. Think of your kidneys like a night shift cleaning crew. During the day, the building is full. Traffic, noise, constant demand. The crew manages. But the deep cleaning, the real work, that happens after the building empties. After the daytime traffic stops and everything goes quiet, your kidneys operate on exactly that principle. The overnight hours are not rest time for them. They are prime working time. And what you give them before that shift begins determines how thoroughly and how effectively that work gets done. Now, here is something most seniors don't fully appreciate. The kidney you have at 65 is not the kidney you had at 40. By your mid-60s, kidney filtration efficiency has declined by roughly 20 to 25%. That is not a disease. That is biology. But it does mean your kidneys need more support overnight, not less, to do the same quality of work they once did effortlessly. And here's where the risk compounds. During sleep, the body goes without fluids for 7 to 8 hours. That gap concentrates the urine. Concentrated urine is where crystals begin to form, and kidney stones begin to develop. After 60, that risk doesn't just increase, it accelerates. Studies published in the Journal of Urology and supported by the National Kidney Foundation show that chronically mildly dehydrated seniors face up to a 40% higher risk of kidney stone formation. And according to the American Journal of Kidney Diseases, kidney filtration rate declines by approximately 1 milliliter per minute per year after age 40. Every decade, the margin narrows. So the goal before bed is not maximum hydration. It is optimal kidney support. The right compounds, the right amount, the right temperature. Those 3 variables together are what separate a drink that genuinely supports your kidneys while you sleep, from one that simply sends you to the bathroom 3 times before morning. Now, before I give you the drink, I want to show you what most seniors are already drinking before bed, believing it is helping their kidneys. Because in my clinic, these 3 come up again and again, and every single one of them is working against you. The first is large amounts of plain cold water right before bed. Most seniors believe more water means better kidney health. And that logic makes sense. It just doesn't hold up at night. Drinking large volumes right before sleep overloads the bladder, pulls you out of deep sleep 2 and 3 times before morning, and cold water forces your kidneys to regulate temperature rather than focus on filtration. The goal at night is not volume. It is quality, timing, and temperature. A smaller amount, warmer, with the right compounds, and your kidneys respond completely differently. That is coming in just a moment. The second is commercial cranberry juice. Cranberry has a reputation for urinary health that goes back decades, and pure, unsweetened cranberry does have genuine clinical merit. But the bottle most seniors reach for at the grocery store, that is 25 to 35% actual cranberry. The rest is sugar, high fructose corn syrup, and additives, increasing the exact load your kidneys must process as you rest. If cranberry is something you want to include, it must be 100% pure and unsweetened. Anything else before bed is doing the opposite of what you intend. The third is commercial electrolyte drinks. Healthy, hydrating, the label says so. But most of these products contain artificial sweeteners, food dyes, and sodium levels that increase your kidneys' workload significantly during the night. The electrolyte balance your kidneys actually need before bed is far simpler and far cheaper than anything in that bottle. No label to read, no ingredients to question. Have you been drinking any of these before bed, thinking it was helping your kidneys? Tell me in the comments. You might be surprised how many people are in exactly the same situation. So here's what I actually recommend to my patients, and here's exactly why. At a biological level, it works. The base is warm water. 1 cup, approximately 200 to 40 milliliters. Not hot, not cold. Warm, close to body temperature or just slightly above. Here's why temperature matters more than most people realize. Cold water arriving at the kidneys overnight requires thermal regulation. The kidney has to work to bring that fluid up to body temperature before it can process it properly. Warm water requires none of that. The kidneys receive it and go straight to work. Gentle overnight circulation to the renal tubules. Filtration uninterrupted. 1 cup is also the right volume. Enough to support kidney function through the night, not enough to overload the bladder before sleep. To that warm water, you add the juice of half a fresh lemon. The clinical reason this works is one of the most underappreciated facts in senior kidney health. Lemon juice is one of the highest natural sources of citrate, a compound that inhibits kidney stone crystal formation by binding directly to calcium in the urine before crystals can develop. For seniors with a history of kidney stones or elevated calcium oxalate levels, this is not a wellness tip. It is clinically significant. The mild natural diuretic effect of lemon also supports gentle overnight kidney flushing, without the bladder overload that large water volumes cause. Now, this one is optional, but here's what the research shows. 1 teaspoon of raw apple cider vinegar. The malic acid in raw ACV supports kidney filtration directly. It also has a mild alkalizing effect on urine, reducing uric acid crystallization, which is a specific risk factor for gout-related kidney complications in seniors. This addition is optional, and I want to be clear about that. If you have acid reflux, or if you are on specific medications, please check with your doctor before adding this to your routine. The final addition is a pinch, and I mean a pinch, not a teaspoon, of Himalayan or sea salt. The clinical reason this matters is electrolyte balance. During sleep, your kidneys require a careful balance of sodium, potassium, and trace minerals to function properly overnight. A pinch of unrefined salt provides those trace minerals in their natural form, without the processed sodium load of ordinary table salt. It supports overnight kidney tubule function and reduces the mineral depletion that can cause cramping during sleep. One important note: if you have hypertension or follow a sodium-restricted diet, please speak with your doctor before adding this. Before today, had you ever heard that warm lemon water specifically supports kidney stone prevention overnight? Most of my patients hadn't, and it is one of the simplest things they can do starting tonight. Now let me give you the complete before-bed kidney protocol. Not just the drink, everything around it that makes the difference. Step 1 is timing. Drink this 60 to 90 minutes before bed, not immediately before. That window gives your kidneys time to begin processing the drink properly. It allows one comfortable bathroom visit before you sleep. And it significantly reduces the nighttime disruptions that rob so many seniors of the deep rest their body needs. Step 2 is the drink itself. The warm lemon water combination we just covered. Sip it slowly, over 10 to 15 minutes. Let your body receive it gradually, never drink it quickly. Step 3 is position. After drinking, stay upright or semi-reclined for at least 20 to 30 minutes. This supports proper kidney drainage and reduces acid reflux. A specific concern for many seniors that is easily overlooked. Step 4 is what to avoid in the 2 hours before bed. Red meat, high-sodium foods, alcohol, and anti-inflammatory pain medications, all of these significantly increase your kidney's overnight workload. Even one of them alone can quietly undo much of what the drink is doing for you. And step 5, pale yellow urine in the morning. Not clear, not dark amber, pale yellow. That is your body's own confirmation that overnight kidney support worked exactly as it should. That is the signal to look for every single morning. I want to tell you about a patient. I'll call her Margaret. Margaret was 68 years old, active during the day, walking, gardening, engaged. But every evening, she and her husband had a quiet ritual they both loved. The evening news together before bed. Something small, something she looked forward to. For over a year, that ritual had become something she dreaded. She was waking 2 to 3 times every night to use the bathroom. Exhausted, frustrated, and quietly convinced it was simply what getting older felt like. What Margaret had been doing every single night was drinking 2 large glasses of cold water before bed. Because she had read that hydration was essential for kidney health. She was trying to do exactly the right thing. When she came to my clinic, the answer she needed was simpler than she expected. I explained what those 2 cold glasses were actually doing to her kidneys and her bladder overnight. We made one change. The warm lemon water protocol, timed 90 minutes before bed. By the end of the first week, 1 trip to the bathroom, then none. She came back for her follow-up and said something I have not forgotten. "Doctor, I forgot what it felt like to just sleep." That is not a small thing. Margaret goes to bed now and watches the evening news with her husband. Uninterrupted, unhurried, the quiet of the house settling around them both. That is what one informed change gave her back. The kidney does not ask for heroic interventions. It does not ask for expensive treatments or complicated protocols. It asks for consistency. The right conditions, given with knowledge rather than guesswork, every single night. I have seen kidney function panels stabilize, stones that never formed, GFR readings that held not because of procedures, not because of new medications, but because patients simply started giving their kidneys what they needed consistently every night before bed. That is not wishful thinking. That is biology. Small choices. Right knowledge. Done without fail. That is what healthy kidneys look like at 60, at 70, at 80 and beyond. And tonight, you have everything you need to start. Are you going to try the warm lemon water protocol tonight? Drop it in the comments. And if someone you love has been waking through the night, worrying about their kidneys, share this with them. It costs nothing. It takes 2 minutes to make. Everything shared in this video is based on published clinical research and over 2 decades of patient care. But it is general information, not personal medical advice. If you have kidney disease, take blood thinners, or manage a chronic condition, please speak with your own doctor before making any changes to your evening routine.